everybody. Welcome to 2022 and our first masterclass. And I'm so excited because it's very overwhelming, the questions you sent and the interest in this masterclass about menopause, which tells me there is so much need for acceptance, for education. I found for you, and I didn't find them because I know Hugo for a long time. Hugo has been my doctor forever. He helped me with my IVF with Pepper. He's helping me with my hormones forever. Also, all my friends. He is one of the most knowledgeable people when it comes to hormonal imbalances. He's the medical director of the private Center for Endocrinology and Reproductive Preventative Medicine in Düsseldorf. Travels around the world before COVID, obviously, and is doing a lot of conventions, so he knows really what he's talking about. Also, I'm super honored to also introduce you to Mariella Frostrup, which you probably also already know. She's a British journalist, podcaster, and presenter, but also wrote a book about cracking the menopause, which is very, very important for all of us to know about, because it's such a topic where there's not many doctors who really can help in a way that we're not confused. Yeah, hormones and all our functions relating to hormones is quite a difficult construction. And if you don't get to a doctor who really knows it, there's no real help. And we are all afraid of what are the side effects. We are afraid of possibly getting cancer if we're taking hormones. Why do we have hot flashes? Why is our skin so dry? Why do we lose elasticity? And so on and so on. There's so many questions around this topic. And what do we need to do? What do we need to take? What can we do about it? Welcome, Hugo. Welcome, Mariella. Thank you so much for being part of this masterclass today. And I can promise you guys, this is just the beginning of, a lot of education around this topic, because I feel like you guys want to learn as much as we can. Hugo, maybe you want to start with explaining a little bit everything around menopause. When does it start? What stages do we have? What is happening to us?
Well, of course, I will start with thanking you, Barbara, for giving me the honor to be part of this masterclass. And as you said before, I'm interested in reproductive endocrinology and also female endocrinology since about 40 years. I traveled around the world, and I learned a lot from other people. So what we are doing now in Düsseldorf is having our own treatment schedules. What is a mixing of what I saw all over the world. Of course, our master is still Professor Huber in Vienna. From that person, you and me learned a lot. And what I'm going to talk to you today is in part of what I learned from Professor Huber. So we developed our own treatment schedules for menopausal patients. And we realized that that is not what the school medicine says, not what the FDA says. So checking the literature, I saw that what we are doing is, for instance, in the United States, not very popular. So we are doing HRT, so hormone replacement. If the patient asks for it and say, listen, I absolutely want hormones. In the United States, not. In the United States, it's a crime to do hormone replace therapy if it's not necessary. So, once again, thank you very much. And Mariella, it's a real honor to meet you. And I hope to have the chance to read your book.
I suspect you don't really need to read my book, Hugo. It's answers from you I'm far more interested in.
Let's start. The reproductive life of the woman starts with the menarche at the age of 11, 12, 13. Then the reproduction possibility starts and it ends, or it stops, with the menopause. Now, Barbara wants us to talk today on menopause. According to the school medicine, the menopause is only one day in the female life. So it is the time when menstrual periods stop permanently. And that's since 12 months. That is the menopause. So if we are going to talk today just on the menopause, we'll be finished quite quickly. So we need to extend the idea of the menopause, and Professor Huber and all the other endocrinologists here in Europe say that the menopause is a one-day event. So we must divide the female reproductive life into 4, how shall I say, subclasses. And it's very amazing that the pre-menopause is starting at the moment of menarche. Of course, at that moment, nobody has hormonal disbalances, but where we start with the pre-menopause is very individual. There are girls who start with their premenopause already at the age of 20, 25. Most of them are starting at the age of about 40. And in that pre-menopause, the first symptoms of the menopause will appear, or the patient feels nothing. Then, when really the hot flushes, the irregular periods, vaginal dryness, chills, sleep problems, mood changes are starting, that is because the ovary doesn't produce any more or not enough progesterone. And that is the moment where the patient are saying, oh, there's something going on with me. What is this? I don't want that. Yeah. And then at the end of the perimenopause, when the periods stopped 12 months, according to school medicine, that is the moment, the deadline. Everything is finished. No reproduction anymore, no production of ovarian hormones anymore. And then we start in the post-menopause. And that is very exciting, Barbara. 150 years ago, the life expectancy of a woman in Europe was 38 years. Now, after 150 years, it is 85 years. That means it's unbelievable. A woman nowadays is longer in her menopause as in her reproductive life. So the reproductive life is, let's say, 25 to 30 years. If the woman dies at the age of 85, she is 40 years in her menopause. And it
proves your point, Mariella. This proves your point of
yes,
saying
absolutely. That
yes.
Culturally, I mean, you know, that medically we've got, or not medically, we've managed medically and in other ways to improve our life chances and extend our lives, but we've not in any way caught up culturally with the idea that women have been, in a way, you know, I talked to you about it being Darwinian. You know, it is a Darwinian process of selection. We are as useful to society, as useful to the world post-fertility as we are our fertility, and as we are during fertility. And one of the really shocking things to me is that, bearing that in mind, why menopause and the periods, as Hugo is describing so well. I mean, it's fantastic to hear it described as 4 stages instead of this like finite cutoff date, boom, you're dead, gone, get lost, get out of the way, because actually what evolution has proved is that we need to cherish this other part of our lives. And if we don't even understand what's happening to our bodies when we're going through it, how on earth can we be in a position to celebrate it? I mean, we are unique. There's only Homo sapiens and 4 types of whales that are all matriarchal societies which is not a coincidence, who have been given this opportunity, who are judged to be, by the process of natural selection, to have as much to offer in maturity. And yet everything about our society tells us the opposite of that. And it's so important to me that that message gets through to women, because I'm sure an awful lot of women listening today, hopefully there's some men out there as well, will have felt that dreadful sense of redundancy that hits you as a woman when you hit midlife, even if you're not experiencing particularly bad or even indeed any menopausal symptoms, which, some women are lucky enough not to experience.
I have so many questions. I mean, the amount of questions, and these questions, I tell you, they're all, 40, what's happening? What can I do? I don't want to age. I don't want to, what can I do to prepare for menopause? What can I do against the hot flushes? What about bioidentical hormones? There's so many questions, and I promise you guys, we will answer all of them.
Oh my goodness. You set quite the challenge. We're here
It's
for
all
the
on
night.
Hugo. It's all on Hugo. But Hugo, can you,
Barbara, may I say something
Yes.
before? Yeah.
Yes.
So
Yes.
nature is very hard to women, because nature decided that a woman is reproduction, and if no more reproduction, it's finished. So that is now the most important thing, that we say after the ending of the reproduction, we have so many years where we must provide life quality, good feeling, good looking to those women. Yeah. And that is what I still wanted to say now, and then I'm finishing. There are two kinds of patients coming to see me. The first have symptoms. They have hot flushes. They have vaginal dryness. They have night sweats. And they say, oh, that cannot be the rest of my life. I go to see an anti-aging endocrinologist, number one. But we have now more and more patients between 30 and 40 who are reading about what is going to happen with them in the next years. And they read on Google and they say, oh, I see already, I don't feel so good anymore. I don't look so good anymore. I don't want that. What can I do prophylactically? Yeah, prophylactically, not to age that quickly and to be in 5 or 10 years an older person. And that is 80% of the patients I see now are between 30 and 40, and they want a prophylactic treatment. Yeah. So that is very important. Patients have symptoms or patients have no symptoms, but both want the same. They don't want the symptoms, and they want to be sure that the symptoms will never.
Okay, what do you tell them, Hugo? We want answers.
Okay.
We need like some really good advice here.
What do you want me to answer?
No, what if the woman comes and says, okay, I'm 40, I don't have hot flushes yet. My period comes, in every month, it's all good, but I want to prevent from, getting into premenopausal state. I don't want to experience the hot flushes. Is there anything you prescribe? Is there anything, people asking about bioidentical hormones? What is it, what you do?
So first, very important, what a lot of doctors are not doing is to listen to the patients. What does she want? Yeah. And of course, you need to do a very clear anamnesis. Everybody is afraid of the side effects of hormonal replace therapy. So you must be sure that all the patients who are at risk, diabetes, cardiovascular problems, cancer in the anamnesis, that you know that before that you start an, shall I say?
Can I just interrupt you there, Hugo, for a moment? Because one of the things that was most upsetting, I think, in terms of my looking into the menopause, was the incredibly bad press that hormone replacement therapy gets. And, you know, delving into it, it seems that it all dates back to about 2002, when there was this women's health survey done in America. The conclusions were released without the medical team involved agreeing them. They were released prematurely, and they basically put hundreds of thousands of women, maybe even millions of women, off hormone replacement therapy, because they were told that the risk of cervical cancer or breast cancer and other forms of cancer was too great for it to be worth taking HRT. And it seems to me that that has dug itself so deep into our sensibilities, and so many women are terrified of hormone replacement. Now, frankly, I think that, you know, you'll know this and you'll be able to give the better statistics, but the risk of cancer from taking HRT is less than if you drink 9 glasses of wine a week. And God knows there have been many weeks when I've drunk more than 9 glasses of wine. And so this whole mythology around menopause and how to support women going through it has developed, with the one thing that can really help being the very thing that's like the forbidden thing. And women sort of go, I've managed to survive without it, and I'm waiting till the last minute before I give into it. And there's all of this pushback against it. And yet, you know, it seems to me very simple. If you have a catastrophic loss of hormones, which is what happens, you know, when you stop producing estrogen, and, you know, we can bring in other things like testosterone and everything, because that's also something I discovered we have. I probably got more of it than most women, maybe. But you know, that those things are actually the imperative thing that we need. And you know, of course, there are women who can't take HRT for medical reasons, but some of the things that you mentioned there, like heart disease, I mean, so many of the symptoms are really things, and bone density. I mean, I discovered I was on the osteopedic, you know, and that only taking HRT helped that, and, you know, brought me back away from the brink of osteoporosis. And yet, as women, we don't know any of these things, you know, which is, it's so incredibly frustrating. I wonder how you think that we're at this completely sort of medieval phase when it comes to knowing how to deal with menopause, and that we don't, you know, we know a lot about periods, we know a lot about puberty, and very, very little, almost nothing about menopause.
Thank you for answering that question, Barbara. But we are 30 years later, Mariella.
Yes, that's why I'm so animated about it. I'm furious.
Yes. So now people who want to be informed will know that the advantages of HRT or alternative treatments are 100 times higher as the disadvantages, yeah, who are in a minority of the patient, and that you must exclude by a good anamnesis. So you shouldn't treat people if you are not experienced with hormones, if you are not asking the patient what happened till now in your life. And if you say, I have a cervical pap smear who was 3A, you will say, oh, if you ignore that and the patient gets later a cervical carcinoma, well, then the judge will say, you, doctor, didn't you know that? So it is very important that we are convinced now that a hormone replacement therapy, however, can never be forbidden for a woman who asks for it, who needs it, because the advantages are so much higher. But as Barbara said before, it must be tailored. So there is no one cocktail for everybody, the same dosage, the same hormones. You give estrogens, progesterone, testosterone, of course. We give a lot of growth hormone, yeah. But always a little bit more, a little bit less, tailored to the patients. And then
Isn't there an argument as well for women to feel a bit more confident about, I mean, I take estrogen gel and progesterone in a pill at night. Isn't there an argument for women to feel a little bit more involved with their care? So yes, some days I feel like I need a little bit more estrogen, other days I don't. So I maybe have 3 squirts one day and 2 squirts the other, and just sort of empowering us to be able to make choices, because we need to be in tune with our own bodies, and we need to feel that we can actually make some choices around, the sort of topping up of hormones, and so many women out there. I mean, it's fantastic to have an expert like you, a man who's truly interested in the topic and has gone to the degree you have to immerse yourself in it. But the fact of the matter is, I don't know if it's different in Germany, but here in the UK, that is not the case. It's an absolute lottery for women whether they're going to see a GP or even a gynecologist who has a vested interest in menopause, and yet it's going to affect 50% of the population. I mean, why do you think it is that not enough doctors know about it?
First of all, endocrinology is not part of the residentship training of gynecologists.
But that's outrageous, isn't it? I mean, say it, Hugo, it's outrageous.
Yes.
Gynecologists study women's biology. So not to study the menopause just seems to me a crime against womankind.
And these are the people who take care of you. These are the people you go to ask for. By the way, I found someone in the elevator here in this hotel who told me he studied medicine. Come and say hi, Konstantin. He's from Bulgaria. And he's becoming an endocrinologist, and he knows everything about our hormones. I had a really nice conversation with him. Very, very interesting. So you're diving in big time.
Big time. It's an honor to be here.
You just met in the lift.
Funny, no?
Yeah, I recently graduated, and now I'm on the beginning of the path. I want to go towards andrology, because we have the same problem with men, with the andropause, with the low testosterone. For example, yesterday I saw research that nowadays people have like 30 to 35% of testosterone compared to the 1980s, which is, it's very bad for men and for the fertility and all that stuff. Yeah. So
and we discussed one thing, and I don't know, we quickly touched on that too. Since COVID and the vaccination, and if you went through COVID, estrogen, levels are decreasing. On the one hand, high estrogen levels give us a little more protection with COVID, but on the other hand, also they decrease, and it's like something we experience. And for me personally, my estrogen decreased while being in this whole COVID phase. So what we talked about it. You had
I also worked in the COVID for 5 months, and I saw a lot of friends, also men and women, and their estrogen just dampered down to the low. When women's menopause accelerated, and I have a lot of friends, men whose total testosterone and free testosterone levels were really down even from the wrong range.
That happened to me. So I'm now basically in menopause, and to me, I had the feeling that really came through the COVID.
But look at you're a wonderful advertisement for menopause. And one of the things that I think is so sad about all the conversations around menopause and aging, for women particularly, but also increasingly for men, as they start getting involved in creams and, things to enhance themselves, is this whole idea that we should be anti-aging. I hate the words anti-aging.
Yeah.
I'm very pro-aging. There's lots of things about the mature me that I much prefer to the immature me. And then of course there are lots of things that I'm not so thrilled about. I could, this face is thankfully saved by your concoctions,
your skin looks
Barbara.
amazing. Your skin looks amazing.
No, not at all. But I'm going to be 60 this year, and it's even in a way hard to say that as a woman, because people sort of go, oh, what do I say? Should I say, oh, well, you look really young, or should I just say you look really great for that age? And in a way I feel like as a society we need to get better at saying, you know what, I'm down with aging. It's going to happen to us all. It's just, how I age and how much I can, enhance that experience and make sure that my body and my skin kind of goes along on the same journey with me as my intellect and my confidence and all of the things that you get out of becoming a mature
thing.
person.
There's so many beautiful things about aging, and I think the term anti-aging, I totally agree with you. And, Hugo, and with Clenze and Huber, Professor Huber, we were discussing this like long time ago. Anti-aging is a terrible terminology for this. But, if you're out in the market, this is what people understand. Anti-aging is just such a strong, okay, this helps me. So people really can relate to this term anti-aging, but we
aging support,
yes,
I like
aging
the idea
support,
of
but that is not what they're looking. They're not looking for aging support. That is almost like the antidote for what they want. It's kind of strange, but this terminology is like something
cultural, isn't it?
Yeah, and we use it too with our product because people just understand, okay, this is what I'm going for here. But I totally agree. I think we can.
It hasn't put me off your products at all, I can assure you.
You know what? That gives me no confidence. I love to hear that. But obviously, when we look at our skin, when we age, we get this weird skin, and
why do you think I'm wearing long sleeves?
Lines in our elbow, and to me. And I think that's what we also learn. We can really be the master of our own bodies. We can do so many things. If it is dry brushing, if it is, look, people think hydration is just like a simple thing. Hydration is everything, And when it comes to skincare, hydration is one of the most important things when it comes to rehydrating our skin, because what happens with the estrogen being low, our hydration level is low. Our UV UV tolerance is very low, so we get wrinkles, we get age spots, we get all this kind of stuff. So it's very important to get this hydration going. So by using the right skincare ingredients, you can do so much already. If we would have the patients to put our face mask on every day, and we could do this while drinking a coffee, that would already be so crazy good, and I show a few products just because I think these are the products we should really have when we are in our mature phase or in any phase. But the super anti-aging skin supplements,
bring it on, I need it.
But it, have you heard of telomerase activation?
No.
Yeah, it's like
so telomeres, and you know what, that is what I've been obsessed with for a long time. This is one thing. And when I started my products, this was what I wanted to have in the products, for skin cells to be able to go through all their cell divisions, because this is what is life determining.
Life determining.
This is where my German doesn't help. But the most proven anti-aging or aging theory is the number of cell divisions, because a turtle has 110 and we as humans have like 40 to 60. So a turtle lives like 200 years. So there you see the number of cell division really matters. And telomerase is an enzyme which basically keeps your cells dividing and keeps cells from going on, keeps cells from going into apoptosis, natural programmed cell death. And that's why it's so important to have telomerase activators in your products. That's in all my skincare products. We did the supplements with the telomerase activation. I think that's very important. And another thing I wanted to show you, which is you cannot get this online, or you only can get this through FaceTime consultations, because it's so scientific. I want this to be explained, how to put this into your routine. But this is actually really for mature skin. Packed with growth factors and exosomes. Exosomes is another thing I'm super obsessed with. And have you heard of exosomes?
Yeah.
Have you heard of exosomes?
No, I've heard of nothing. I just slap it on and pray.
Yeah, that's good. It's good. But exosomes are basically signaling tools between our cells. So when we age, our cells are all over the place, and they don't really communicate with each other anymore so well. So we need to give them a little support. And it's like basically upgrading a landline to the newest iPhone. Yeah, that's the exosomatic line. And that is just like 2 serums everybody should have, especially for mature skin. But we can do a lot to keep our skin fresh, our moods up. For example, I started heavily on meditation. I'm doing my Pilates workouts. I'm trying to jump over fences with my 7-year-old. I mean, we can do.
It's interesting what you say about, a meditation and Pilates and things, because some things do have to do change,
Yeah.
And I mean, like, for example, when I spent 2 years total insomniac, full of anxiety for no real reason. I could worry about the shopping that I needed to buy, to feed my teenagers, or I could worry about world peace, on the same level all the time, and I didn't understand those things as menopausal symptoms until finally 2 years later, I happened upon a really good female gynecologist, Sarah Matthews, who said, I don't care what the blood tests say, because so often, I'm sure Hugo will confirm this, the blood tests, our hormones are all over the place. So 1 week we can look like we're perimenopausal, 1 week we look like we're postmenopausal. I had 3 different blood tests, all told me different things. But ultimately, she said, I just listened to what the patient is saying, as Hugo was saying earlier, and listening to them tells me whether or not they're on that progression. And then certain things become really important, like learning. When I made my program for the BBC about menopause, they sent a group of women off to do CBT, cognitive behavioral therapy.
Yeah.
And I was really skeptical, because I thought it just played to that whole myth of the hysterical woman and, breathe your way through it, and please don't patronize me, I kind of thought. And yet this group of women went and did CBT, and it really, really helped, particularly with hot flushes. They managed to reduce their anxiety. They managed to reduce the amount of times they were hot flushing, because of the fact that they were able to pull back and understand what was happening. And they understood that if they breathed through it, everything would calm down. And so things like meditation, as you say, things like Pilates, weight training. I mean, I had a phase of going to the gym when there was a really handsome guy there, and I used to just go to look at him, but I've never been very good at going to the gym. But weight training, incredibly important, for your bones, for,
Yes.
to combat the osteoporosis and things. So even outside of all of the amazing creams that you make and the wonderful hormones that we can take to supplement those things, there are also, I'm interested to know from Hugo actually the alternatives to HRT, because in a way, like CBT, we looked at it because the need to be alternative, because there are women who can't take HRT. And I think some of those things, the things you're describing, like doing Pilates, learning to be kind to yourself, learning to meditate, learning to breathe through the stresses, and develop a kind of, by being kind to yourself, develop a sort of more optimistic frame of mind about the process you're going through, are all very important. They might not be medical solutions, but they are mental solutions. I don't know what you feel about that.
Interesting, because last night I think I was up for 2 hours thinking about freaking everything, and that's like this anxiety, like, what's going on? I'm such a good sleeper. I'm really such a good sleeper. And I have, when I'm back in Düsseldorf, I have an appointment with Hugo. I will have to get on everything Hugo is telling me to. So Hugo, help us, please.
Help, Hugo.
May I go back a little bit first? Because you said, why do gynecologists are not familiar with endocrinology? The problem is that gynecology is getting so complex. You have oncology, you have reproductive medicine, you have endocrinology. Nobody can be a specialist in oncology of the female and be a reproductive endocrinologist. We have in Germany, to do a reproductive endocrinology, you must work 4 years in a reproductive center, 4 years. And without that, you're not even allowed to do an egg retrieval. You are not allowed to counsel patients. That's the same thing with endocrinology. Endocrinology is so complex, so difficult. And I learned.
Hugo, you don't have to study for 4 years, do you? I mean, that's the thing. I don't understand why menopause should be treated as less complicated and less important than reproduction.
But I agree. But you said before, you go to a GP. You do not go to a GP.
But lots of women don't have the choice. I mean, particularly if you're dependent, let's say in the UK, on the national health system, you know, that's where you go. You go to your GP, and then the GP says things like, I don't really rate HRT. And you think, I don't care whether you rate it or not. I want it.
For your heart transplants, are you going for a diabetes treatment to a GP? No. No,
but that's why the system needs to change. The recognition of menopause as a specific phase of women's life, a liminal, you know, a passing phase that can be supported so much better if, you know, starting right from the very beginning with the medical profession, you know, it's treated as important, you know, and that's, I think, fundamental, isn't it?
Yeah. So I'm not doing obstetrics. I'm not doing oncology. I'm only doing that what I think I know quite good: reproduction and endocrinology. And as I said before, hormonal treatment is not starting with hormones. The follow-up is so important. So if you give a patient hormones and she lost the follow-up, you never hear from her anything anymore. That are the patients who are going to scream 10 years later, I got cancer and hormones are so bad. So now we know if you do hormonal replacement therapy in patients who have no contraindications, it is safe and good. And you said before, of course, there are patients who cannot use hormones. With hormones, we need estradiol, progesterone, and testosterone. I say to Barbara in Los Angeles, testosterone, androgen is the life quality of the aging woman. Yeah.
But how do you, if you take testosterone, I did for a while and then I stopped because I was just getting really hairy. Yeah. And that was a bit of a shock. I mean, and not hairy in the places you want it. Yes. Like, you know, the top of my head was getting thinner, but I was developing a bit of a beard, quite frankly.
But that are exactly all the secrets. You get to know what testosterone or what androgen you're giving, what anabolic you're giving. Are you giving growth hormone, what is also an anabolic? And of course, how you give it to the patients. Do we give it as tablets? Never in women. Injection, never, always through the skin. And then the dosage that you must know what's going to happen. So you must cover the hair and the skin with an anti-androgen. Yeah, but that is all, as I said before, you must take care of your patients. And if you had acne, you had roseola, you had hairless, you get hair where you don't want it, that is just a dosage problem. Yeah. And you do not need to give testosterone. You can give DHEA. What everybody knows in the US, everybody's taking DHEA in the US. Here in Germany, it's a crime to give the patient the DHEA. But that is the surrenal androgen that in the woman is converted to about 70% into testosterone. So also DHEA could give severe side effects. That means—
Can I just say at this point, because I think that one of the really difficult things with menopause is that women are terrified of it. And, you know, I hope I'm speaking for, you know, I don't know what the opposite of, what's a fraternity, which is ironic because that's a brotherhood, but nevertheless, in that, you know, there's so much information. You know, if every woman could have access to Hugo, if you could clone yourself, perhaps, I mean, you seem a very intelligent man. I'm sure that you could possibly look into that. And then that would solve a lot of our problems. And we could have hundreds of you scattered around the world. But at the moment, we don't.
The next. We send him to school with Hugo, and then I already have this planned out.
We'll clone you both. I don't want to be ageist, though. So I think we have some Hugos. But you know,
treat us all.
I think that for women, the very first stage, I mean, obviously treatment or support is incredibly important. I mean, what you put onto your skin is incredibly important. You know, all of the creams I used before my menopause just, you know, didn't work anymore. They were useless. They were redundant. I mean, it was like finding the Holy Grail when I found your creams, Barbara, because suddenly my skin went, oh, hello. Yes, that's what I need, you know, and I could feel it, you know, I could feel a difference in a week, you know. But also, I think as important as all of those things is how you feel about yourself going through it, and how you have to understand that it's not a judgment, that it's not something that you can fight against, that actually you're going to use up all your energy and increase your stress levels if you're battling the menopause or the menopausal period, which really, as Hugo said, starts, you know, possibly in your 40s. And we need to be able to talk about it more just amongst each other, because, you know, I sit and talk to 3 women. If I say, yeah, you know, when I went through the menopause, then I started using Barbara Sturm's creams and then my skin felt better. I'm passing on information that's important. But as long as we feel ashamed of talking about it, as long as we think that it's somehow some kind of mark of embarrassment and we don't want the world to know, then we're not ever going to be able to get the information we need to make it easier and to make it a more positive rather than a negative experience. And I mean, that's why I wrote the book, because I wanted it to be a kind of an easy introduction to what's going on, but more than anything else, a kind of call to arms to go, come on, this is nothing to be ashamed of. 50% of the world's population is going to go through this liminal phase, and we've all got to learn to talk about it, to say it proudly, to go, yeah, I'm a menopausal woman, you know, what have you got for me? And that seems to me, you know, I mean, in a way, Hugo and you and I are representing the sort of holy trinity of what you need to have a successful menopause, which is you need, you know, products that help your skin, because there's no question it goes into a very steep and immediate decline. You need hormone replacement, because the reason all these things are happening is because your hormones are decreasing, and you need to be able to feel confident and proud at a time in your life when the world is telling you, you know, that you're redundant as a human being. And that comes, I think, from women coming together, you know, as you've facilitated today, and talking about it and you know, sharing their experiences, because there's so much still to learn about it as well, because we've been silent, trapped, you know, it's been a lid on it for hundreds of years, really.
Absolutely.
So we need to fight from the inside and from the outside. Yeah, Barbara is treating the skin from the outside, and we
And
need
the
to
inside.
from the inside, yeah, from the insides, by influencing, you know, all that, the collagen, the epidermal thickness, and the structure of the subcutaneous fats. And that is all androgen related. Why do men have practically no wrinkles, or have no cellulite, or get it later? Because
Why? Tell me.
because skin is thicker, the epidermis, the upper layer of the skin is thicker. The collagen, yeah, is, if you do a scan of the collagen in the skin under growth hormone or on androgens, that is a huge difference with if the woman has only estrogens. And of course, also the subcutaneous fat structure, as I said, yeah? So that doesn't react on estrogens. So you can put on the skin estrogens as much as you want, that will not get a thicker collagen layer. That is what we are doing. Look at the bodybuilders. The bodybuilders, they have a thick skin and then nothing anymore, and immediately the muscle. They have no subcutaneous fat, but the skin is very thick because growth hormone and anabolics. So
tell me this, because I just saw a question pop up on the screen, and it is, I'm afraid, one of the sort of things that people get most embarrassed about. And it was someone asking how you hydrate the vagina. Am I right in saying, because it is a big issue for a lot of women, and it also means that you end up, you know, not being able to control your bladder properly, and there's so many problems that women experience, again, you know, that they're ashamed to talk about. Is it right that you can use that you can and should use vaginal estrogen, like a pessary, at the same time as you use a gel on the skin, and that can really help?
Yeah, but we discussed that already in Los Angeles a few weeks ago, Barbara. Vaginal dryness is a very big problem. Yeah. So the problem is that the vagina and the epithelium, so the inner layer of the vagina, is reacting to another kind of estrogen, as for instance, the skin. Yeah. So what you're putting on your skin is estradiol. What you're using in the vagina is estriol. That is E1, estradiol 1. The advantage of that is that it is very lubricating. It's a good
Lubricating.
And second, it's not resorbed. So you can do that in patients with breast cancer. In patients with breast cancer, you cannot give estradiol, but in the vagina, you can put a lot of things that are not resorbed. And that is, for instance, there are at least 30 different medicaments, but they are all not estradiol. They are estrone or estriol. So that is another molecule that you can put in the vagina. So if you're putting estradiol on the skin, that will also work on the vagina. Yeah. But if you have only vaginal problems, you have only incontinence, it's very interesting. The bladder is very close to the vagina in a woman. Yeah. So if you put estrogens in the vagina, it will also go into the bladder and will be a good solution for incontinence.
Means you can go trampolining again.
Yes.
If you want to, if your bones are up to it.
So vaginal dryness, Barbara has also products for that. Maybe she should say something about that.
Oh, the V collection. The V collection, we did like V drops, V wash, to make sure that the pH is respected, the microbiome is respected, that we don't use harsh ingredients in our vulva and vagina area, that you actually respect the area and the, you know, the whole physiology of this area. So we have like the V wash, which you use under the shower instead of like some, let's say, cheap, you know, shower gel soap. You know, soap, the pH of a soap is like super alkaline, and our vagina is super acidic. So, and it is important that it stays acidic so that we don't have problems with bacteria, or, you know, lots of people get UTIs and we don't often know why we have it. So to respect this environment, vulva, vagina, we created those care products for, you know, and V drops, which is basically hyaluronic acid based, which also has anti-aging ingredients. Also
I want to anti-age my vagina.
Yes. So yeah, that's also a thing. That's a thing. You know, that is a thing also in the aesthetic medicine. That's not even, you know, a joke for like rejuvenation of this area. But you know, if if you shave your vulva, what do you put to take care of it? You know, it's nice to put like a hyaluronic acid on and have some, you know, anti-inflammatory ingredients, but also pH regulating ingredients. It's nice. It's good.
Do you know what I think is really nice is that we're sitting here having this conversation, because it's a very, very, very rare one, and I think that's, you know, incredibly important. And I really commend you for you know, facilitating it. But
if you're up to, let's do more. I think, I mean, like, I cannot get over all these questions, and I know there are like lots of questions waiting here. You know, maybe, I don't know, should we dial someone in to join our conversation? That would be kind of nice.
Hi. Hello, everybody. Hi, everybody.
Hi.
Hello, thank you so much for this wonderful informational, all three of you. It's great to hear. So a little about me. I'm actually in New York right now, but I have lived in Los Angeles and I also live in Paris. So I'm 58 years old and I have been, I think, in menopause for the last 4 years. And so I've been under treatment from different doctors, one in LA, I was in New York, and now in Paris. And I am an advocate of living a good life. I mean, of course, skincare is very important, but I think inside is really important for me. And I am an advocate of HRT because I'm in it right now, but I've gone through different treatments. And unfortunately, I'm not normal. Things work with me for a little bit and then they stop working. So the Los Angeles doctor, wonderful, wonderful gynecologist, put me on a, progesterone and a patch. It worked for a while and then it stopped working. And then in New York, I went to a bioidentical doctor. And so I was doing injection. I was taking the progesterone at night, but doing the pellet injection under skin. And she was doing the estrogen and testosterone for a while. And it worked again for a bit and it didn't work. So basically it seems like 2 weeks of the months, 3 weeks I was miserable, 1 week I was good. And I was doing blood tests before that. And now in Paris, of course, every doctor is different and every country has their own way of things and doing things. And the doctor in Paris, he says, we don't do injections. So I'm taking progesterone and estrogen on the skin, the cream. So unfortunately, as I said, I'm not normal. Things work with me and they don't work. So I'm having hot flashes still at night and I was having bleeding. So the bleeding part is, of course, is not, it starts worrying because of cancer. Back to the doctor. Last year it happened, gave me something to stop it, did all the tests, everything that they're supposed to do, no cancer. Started again this year. Went back a month ago and he said that everything is fine, but we have to find out if there is nothing else that is disease related, whatever they call it, that there's no other significant thing that is causing it, because it's not normal to be on HRT and be bleeding at the same time and having hot flashes. Well, bleeding, forget about it, having hot flashes at night. So I have done some blood tests, like series of blood tests. The first rounds were fine. I'm still waiting for the result of the other ones. I don't know which one he's trying to say. So what I'm trying to say here, what's the end? Because I personally can't take it anymore. I cannot,
we need your help.
I can't take it anymore. It's like waking up in the middle of the night and not being able to sleep. That's the most important
thing. So bad, isn't it? I know, and I still go through it every now and again. Absolutely, it's so debilitating. It makes you feel like you're going crazy.
I know. And forget about COVID. Actually, I just got, I'm triple vaccinated and I got COVID too at the same time. So there's so much happening. And I wake up in the morning, I'm exhausted because of, and I'm asking Dr. Hugo, I'll come to Germany. I'll try Germany this time because, 4 countries, 3
Come and visit us.
I will.
Dusseldorf for you.
Anywhere Dusseldorf. My cousin lives there. So if I could find a solution, because apart from weight gain fluctuation, apart from skin, this, whatever, for me, the most important thing is to be able to sleep. And if I don't sleep, I think everything is just irrelevant at that point. And the hot flashes only is during the night. It's not during the day. I get this.
Hugo, come on. Hugo, who we're going to clone. Come on, Hugo.
Oh, me.
Mina,
yes. Hello.
I cannot answer your question at the moment because information you gave me before, is so extensive.
I know.
We cannot, on what you say now, say, oh, I have the solution, do that and that and that. So that is the patient that we don't like that much.
Thank you.
No, he doesn't mean it personally.
No.
Hugo, what happened to your bedside manners? Come on.
No, I get it. You don't like us because you don't have is it complicated?
An instant answer.
No.
Yeah.
That everything what the doctors are doing is going wrong.
Okay.
Yeah. So I believe the doctor in France, I'm Belgian myself, so we love France. But I think he's right. The way how you give hormones is very important, and you did lots of hormonal checks We know that patients sometimes have a very high FSH, a very low estradiol, and they feel perfect. And other patients are feeling terrible in their FSH, and the estradiol is absolutely normal. So that means there is most of the time a correlation between the hormones and how you feel. But what disturbs me the most is you bleeding. Yeah? That is the reason why we lose our patients. If we give hormones and the patients start having menstrual bleeding again, and especially in the menopause, the patients are thinking immediately, I have endometrial cancer. Yeah. So you do hysteroscopy, you do endometrial sampling, you do whatever you want, you do tumor markers.
They've done that.
I'm very fascinated of tumor markers, but at the moment I cannot say you, oh, Mina, no problem, do that and that and that.
But Hugo, I'm not a doctor, but can I just say, Mina, I met a lot of women who are still going through the hot flushes. I can't answer any of the other things, but as I was saying to Barbara earlier, one of the things that they found really helpful, and also I found really helpful, not CBT because I didn't go and do the course itself, but you know, I've got the Calm app, I've done mindfulness, and what I found incredibly helpful, I didn't really suffer from hot flushes, but 3 of my best friends did. I had 2, and I know what they feel like, and I really pity you. But 3 of my friends did have them really badly, and all 3 of them have managed to seriously reduce them by doing CBT or a version of mindfulness where they recognize the sort of feeling that they're having. I mean, at night, I often have to do breathing. I have to breathe in for 5, out for 5, not to go to sleep. I go to sleep fine, but I wake up at 2 o'clock in the morning and suddenly I'm worrying about whether I put eggs on my shopping list. You know, I mean, crazy stuff. And I have to do this breathing, and it really helps. And you think it's not going to work, and you keep giving up, and your mind drifts off again. It's like being in a yoga class, you know, where they sort of go, just, you know, just be calm. And if your mind drifts, pull it back. And I think that might really just help just with that bit, which, you know, as soon as you get some sleep, the world feels like a better place, and you can rise to the challenge of the other symptoms that you need to deal with. But I'm also interested because you did the patch, you did all that stuff before. The only thing that worked for me, and I have to change my dosage, you know, week to week, depending on how I'm feeling, was on the skin. The patches, they'd fall off, I'd forget them. Also, I felt like I was branded, you know, like a cow or something. So, you know, I think that you might be on the right combination, but obviously, as Hugo says, everyone, it's subjective. But I do think CBT might really help, just to kind of get you in the right place to carry on this interminable attempt to kind of mitigate your symptoms. But I'm not a medical person.
What you just said may work for hot flushes, maybe for insomnia, but never for bleeding.
No, of course, I know that. Yeah.
And second, transdermal application. Patients don't like to put 3 different hormones on their skin. In France, we have progestogel, estrogel, and testogel. Yeah, so the patients are getting crazy of in the morning put or then behind and testogel, then or they décolleté, they put the progesterone, they put on their face the progesterone, they put on their shoulders. They don't like that. So my preferred combination is always estrogen, so estradiol, and progesterone as a pill. Yeah.
That's what I take.
That's my combo, and that's what I love.
Estrogen and the cream. But to your point, Mariella, I do sometimes pump up the estrogen to be able to sleep. But it's just that it's just so many fluctuation all the time. And I'm going through like this. And how long do we continue before a risk for cancer? I mean, even though my doctors say 5 years is good, we keep it under monitor, but do I have to continue?
But I think it's a whole, I mean, Barbara will have to take over because, I mean, it's a whole other thing, but I think the whole, and maybe Hugo will be the one who knows the answer to this, the whole thing about how long do you take HRT, you know, my gynecologist says she's going to be taking it till the day she drops dead. And I kind of, I'm with her on that. I don't see any reason why I'm going to stop taking it, obviously, unless I have health concerns. I don't think there is. I think all of that stuff is the sort of mythology that needs to be investigated. We need answers from great people like Hugo who are actually interested in the topic and finding out about it, rather than, you know, guesswork from uneducated medical practitioners, and indeed any number of kind of witch doctors out there.
We'll take it forever, as long as it
guessing.
works.
Yeah, same here. I have to catch a train to London. I know that that's really brutal, but if I don't catch it, it's the last train of the day.
You go to London, and let's do this again.
Love to. I mean, I've so enjoyed it.
Hugo and I, we talk to a few more of the patients, and then we do this again. Thank you, Maria. Catch your train. We love you very much. You're such a great advocate for all the women out there. And
look at you. You're like, I mean, how you can even mention the word menopause and that beautiful, glowing, youthful face. You know, it just seems like a crazy.
That's what it is.
But you know, but what you do is you break the mythology around it, because, you know, for women to see you and understand that you can look like that and be going through this thing that they're all so terrified of. It's brilliant to have, you know, role models, examples of why it isn't the end of the world by any manner of means, you know.
No, we
look at all the energy I've got. I've done this, and now I'm going to get on a train.
Yeah, we're super energetic, and we're young, and we
You're
got
both
this.
beautiful women. Anyway.
Exactly. But nice to meet you, Mina. Hugo and Barbara, so great to join you and talk about this. I just found it such a positive, you know, life affirming creams.
Where are
See you
you now?
later. Big kiss,
Okay.
Mariella.
Bye. Thank you. Bye.
Where are you?
So Nina, you have to come to Germany.
I will.
We're making plans here, so you come.
You're in Los Angeles.
Sometimes he's in Los Angeles, but you need to see Hugo. That's very
I will definitely look into Mr. Dr. Verhoeven, right?
Yes,
Nina.
we will.
Nina?
Everybody out there, we will connect you with by email with
Yes.
Dr. Verhoeven, and
Nina, send me an email tomorrow.
Okay.
Scheduling what was done till now, and if you have all your blood results, scan them and send them to me.
I will. The last one. Yeah. Thank you so much.
It's in Düsseldorf or wherever in the world, and we try to find a solution for you. I'm not God.
I'll come to Düsseldorf.
yes, we cannot wait to have you. Let's talk to some other patients. Okay, Nina, I see you in Düsseldorf. Thank you for joining
So
today.
much. Thank
Very
you.
cool.
I mean,
Hi, everybody.
Hi.
I'm Nadine. I'm originally German, used to live in Los Angeles, moved to south of France 2 years ago. I'm 42 years old, and assume now from everything that I've learned today already that I'm starting to maybe go into my pre-menopause. I think I had my first anxiety attack about 2 years ago, and now that I've heard about all of this, I assume that was maybe the starting fireworks. I got it under control, thankfully, with meditation, mindfulness, and, you know, more self-care for my skin, for everything. You mentioned Pilates. I think that helped me tremendously, doing it 2-3 times a week. My original question, though, before I learned about everything else, was really just to learn a little bit more about what I can do before going into menopause. I mean, maybe I'm already like on my way, but I till this morning, I thought that, you know, maybe there are some supplements, or, you know, maybe even food, or, you know, stopping to drink coffee, or, you know, certain things that you would say, you know, give me a longer life in the fertility phase.
Barbara, you answer that question. You start, and then I add the endocrinological aspects of what we can do.
Yeah, so I can obviously help with skin-related questions, with questions relating, you know, telomerase activation, what I already talked about, exosomes, growth factors for the skin, hydration for the skin, what you already talk about, mindfulness, certain foods, anti-inflammatory diet is always the key to the best health possible in every stage of our life. Anti-inflammatory means like mostly vegetable-based, plant-based diet, green leafy vegetable, oranges, cherries, walnuts, mackerel, salmon, cut out dairy, stay away from processed meat, sugars, obviously all the usual things we already know, but anti-inflammatory diet is something we shouldn't excessively look after, but if we go into this direction, that definitely helps. Hugo, you probably know better what kind of food regarding the hormones would work, or what should we do? You talked to me about women in Asia who eat a lot of soy, isoflavone help with, maybe this is something Nadine can already start with, but I'm not the expert on hormones. This is something you have to tell Nadine.
Okay, so there are 4 important things. What do you eat? When do you eat? You certainly have heard about dinner canceling, yeah? So
Yes.
that means in the evening and during the nights, the growth hormone production is the highest, and it is the best anti-aging for the brain that we have. If we have a full stomach, the growth hormone is used for digestion and not for anti-aging. So that is what we all learned from Professor Huber. In the evening, do not eat too much. Do not go to a Michelin 3-star restaurant and you're starting at 7 o'clock and you come out at 2 o'clock in the morning. What's happening? The next morning, you wake up and you say, "Boah, how do I feel? I feel so bad." You go to the mirror and you say, "And look how bad you're looking." Yeah. So that is what we want. We want to feel good and to look good. So first of all, do not eat anything what is heavy in calories in the evening. Yeah. Number 2 is very important. Mental training, what you are doing, Pilates, meditation. Yeah. Number 3, exercising, that you are certainly doing.
Yes.
And number 4, that is my hobby, that is endocrinological or hormonal balance. Yeah. So that is the reason why you say you are in your premenopause. No, you're going into your perimenopause. Your premenopause is over. In the premenopause, patients have most of the time no symptoms at all. They have no hot flushes. Yeah. If you do a hormonal check on them, yeah, what we do in all patients who are starting a contraceptive pill, for instance, sometimes we say, "Wow, how can that be that the hormonal profile is so bad? She will need to do something very soon." Yeah.
Yeah.
You are now having symptoms. You see that your skin is changing. You do not feel so good anymore. You are tired. You are exhausted. So you're coming in the perimenopause, and you will have soon, whether you want it or not, you will probably have menstrual cycle problems. You will have irregular bleedings. You will get, well, all the symptoms we discussed it today. And the end of that will be menopause, that the hormones are so low that the ovaries do not produce eggs anymore and do not produce hormones anymore. And that is a moment where we would say, what are we going to do? If the patient says, "I feel good, I don't want anything," yeah, don't force her. Yeah. But most of the patients, at least the one who are coming to me, they have symptoms. And some of them say, "I do not want any hormones." Of course, we have alternatives. Barbara said just before, we have the isoflavones. The isoflavones is female hormones that are in soy, for instance. In soy, the isoflavone is called genistein. Yeah, but that is only one of the 4 isoflavones. We have also dichain, formononitine, and I forgot the 4th name. And the best combination for that is red clover, Rotklee in German. Red clover, of course, from the Vienna school. That is one of my preferred preparations. So if you go where are you now in France?
I'm in close to Cannes, but I come to Germany a lot, so I could get.
But you can look into the internet and look to menoflavone.
Okay.
Menoflavone. Yeah, you have different ones. I proposed that to Barbara in Switzerland, but she couldn't get that. That is a good.
That actually made it worse, Hugo. I have to say, whatever I found in Switzerland was not good, so I stopped taking it actually.
Because you didn't take the menoflavone, you were only taking genistein. But from the other side, what was it? Nadine or Natalie?
Nadine, yes, it's Nadine.
The clue, the best thing will always be to check your hormones.
Yes.
Yeah. And if they go down, especially the testosterone level, as I said before, testosterone is the life or the quality life of the aging woman, because it's good for the skin, it's good for your mood, it's good for your muscle growth, fat reduction, of course, libido, everything is linked to testosterone. Okay. So most of my patients in your age, they're coming with DHEA, as I said before. DHEA is the surrenal androgen that is converted in the woman, mostly in testosterone, in men, mostly to estrogens. So men who is taking DHEA are very happy, but they are having female symptoms. They get breasts, their voice is going up, but it's not important for you. But everything, the most important thing is always never do experiments. You must always stay under control. See, does that happen or not? We have alternatives, side effects, advantages, and you must say that and that I don't want, that I want.
But how often would you see a patient like me? You see someone like me maybe one time, you do all the tests, you find out what I need, and then you see me every 3 months? Or, I mean, obviously, if I don't feel good, I would come more often, but how does this actually work? Is it something that continuously has to be developed?
Well, you will wonder that many of the patients are requesting much more control as I want to do. They say, no, do not come in 1 month. Let's see each other in 3 months. Yeah. And so normally in the young patients, I always say, let's do the diagnostic. Let's make a protocol. The best, call me or write me in a month. Especially if you're in Cannes, you write me. And then I say, okay, it's time that we see each other again. But every 3 to 6 months is certainly good. The older patients, I can tell you, they come much more frequent because they say, oh, I have a little bit on my nose. They call me in the middle of the night and say, doctor, I have acne on my nose. Can I come to see you tomorrow? Yeah. The younger patients, not. The younger patients are more seeing what's happening, and they write and they say, my bleeding is irregular, or what can I do? Yeah. But you are in Cannes, that's very close to Düsseldorf. Huh?
Yeah, direct flights, exactly.
Okay, we get everybody to Düsseldorf.
I love Düsseldorf, so it's all good.
Barbara, I only want the special ones, the very...
the motivated ones. But Dr. Sturm, just for the supplements that you mentioned earlier, is this something that you would definitely also advise for my age group?
Yeah, not just for you. Everybody should have that, no matter male, female. We changed the name, so I always forget. Skin, what is super anti-aging? It used to be our skin food. It's telomerase activating, it's anti-inflammatory, it's antioxidant, has really the best ingredient, glutathione, astaxanthin. It's fantastic. Astragalus, purslane. This is something 2 pills a day. Everybody should take it. And then we have another one. We changed it to the name Recovery, which is extra anti-inflammatory. So this is for everybody, especially also if you have some people have like muscle or joint problems. Taking inflammation out of this is amazing, especially if you do sports. But overall, these are like not the usual supplements you would take, you know, your multivitamins or whatever. These are really like innovative, very cutting edge science use supplements. So the recovery and the super anti-aging, these are two. And then we just brought out our tea. We have a porcelain tea. It's so delicious and it's fantastic. You know, you drink it in the evenings, it's or whenever you want to, but it's extra anti-inflammatory too.
Sorry, what are your thoughts on collagen? Is that something that you believe in, or?
It's not that I don't believe in it necessarily. I personally hate to take animal trash. You know, I just, you know, don't want to have, you know, pig trash and fish or whatever it comes from. It's just like, I find it gross. And that's why, you know, we're looking into it and finding like an alternative for this. But like as it is on the market, I'm not really interested in it.
Okay.
So go for the, you know, telomerase activation, anti-inflammation, hydration, nutrition, that is antioxidation. That is really what you can do for the inside and out.
Perfect. Thank you so much for all your help.
Such a pleasure meeting you. And I see you in Düsseldorf. Hugo, one more.
Okay,
Hugo, one more. It's time for one more. I know there's so many people we cannot see today. Hugo, are you free next week to do another session of patients so you guys can all come back and we do like a consultation hour just talking to you, okay?
What can I say, Barbara?
I know you cannot deny any favor I ask.
No. Yeah. Anyway, we need to talk next week anyway, so we can enlarge it and to what's the time now? Oh, we are already an hour and a half.
Shift. I know, Shift. One more?
One more, sure.
We're done today. Good. So the team says that's it for today. Hugo, thank you so much. Everybody out there, we're coming back. We're going to answer your questions. Please sign up for any information you need. Also, if you want the access to Dr. Verhoeven, we connect you with him and his email. You also, when you want to come to our website, we have a bundle, like a menopause bundle put together for you. Whatever you need, we have FaceTime consultations. Look into the exosomatic line. You can also get a FaceTime consultation for that, or you come into our spas in Los Angeles, Miami, New York, Düsseldorf, London, and you can get those amazing serums, which are really life-changing. Yeah, and stay in touch, and we're coming back next week, promise. Lots of love to you. Hugo, thank you so much. Team Sturm, thank you. Konstantin, thank you for jumping into our session. And I will connect Konstantin, Hugo. Hugo, this is your new student here. We will all work together.
We'll fight together.
Yes.
It was an honor to meet you. It was a pleasure to participate in this meeting.
Always a pleasure.
Thank you, everybody. Bye.
I see only you, Barbara. So to all the others, bye-bye.